Greetings, my name is Edward Amron and I'm a clinical physician experimenting with nutraceuticals and pharmaceuticals for the past 5 years to mitigate the stigmata of the human aging process. Today I'm going to review the benefits of metformin and niacinamide therapy for the past 5 years and introduce two new therapies, N-acetylcysteine and glycine, which may be multiplicative in terms of benefit. So I hope you'll join me for the next 15 minutes while I discuss my personal experiences with these therapies, and I welcome your commentary. I'd like to share an anecdote regarding the COVID-19 pandemic and use it as a model for an emergent disease of aging. The effects of age and aging as a risk factor on recovery from COVID-19 pneumonia were devastating. Our older citizens did not do well. If anything has been made more clearly evident to me is that our older adults are physiologically and immunologically decompensated from our younger adults. And you might say, well, isn't this observation obvious? Well, in my career, I've never seen an infectious disease devastate a particular age group as much as COVID-19. The normal human repair and recovery mechanisms totally failed. We need therapies that recover the human body to a younger state, not only to improve health span and lifespan, but also to increase the likely recovery from an acute severe illness. So now we can focus on the topic at hand. Advancing age leads to a chronic inflammatory state. This is termed inflammaging and an inability to respond or recover from an infectious threat. This is noted as immune senescence. Treatments of human aging have to mitigate inflammaging and immune senescence. The addition of glycine and N-acetylcysteine supplements may augment the effects of metformin and niacinamide and merit further discussion. So I have completed 5 years of therapy, and treatment benefits from these therapies take a long time to realize. They don't happen in the course of weeks or months, but in a time span of years. And I'd just like to note some subjective improvement. Currently, I have no active medical problems or prolonged illness. I have preserved my lean body mass at approximately 25 kilograms per meter squared. When I started 5 years ago, my body mass index was about 33. And no additional weight loss was noted after the first year. Further, symptoms of osteoarthritis, a disease of aging, have nearly disappeared, only occasionally becoming noticeable. My strength and stamina and sleep quality are well preserved. Further, I would argue my cognition is unchanged or possibly improved, which says a lot as you move through your 50s. Now, there are notable objective improvements with niacinamide and metformin. Blood pressure, heart rate, hemoglobin A1C, lipids, thyroid function are all normal. I have frequently checked my laboratory studies. Now, I would argue there has been some benefit in reducing blood pressure with this therapy. However, the treatment probably is not as effective as a standard antihypertensive drug. C-reactive protein less than 0.5, that's below what can be measured. And that's a marker of generalized inflammation. One thing I'd like to note as well is I suspect that the way my body metabolizes free fatty acids relative to glucose has changed. I do think that I rely more on triglycerides and free fatty acids and glucose as a secondary energy source. This mimics more like what a younger adult uses for metabolism. And I believe this is the mechanism behind the loss of weight and the maintenance of mean body leanness. Also, I do think there is some improved skin texture, color, and decreased age-related skin conditions. However, the aging process continues. I've noticed senescent changes to the skin, the loss of elastin and collagen, the development of some non-malignant age spots like cherryangiomas. Further, it is difficult to build body mass with this regimen. And there has been a publication in Aging Cell in 2019 which discusses a possible mechanism by which metformin inhibits the development of muscle mass and improvement in aerobic respiration. This is speculative, but it merits discussion. Presbyopia, which is the loss of near vision, continues. This is an age-related event, universal amongst all individuals after the age of 40. Also, graying of the hair, androgenic alopecia or male pattern baldness continues. That would be nice if there was a treatment for some of these additional age-related complications. Also, the niacinamide metformin regimen has no significant benefits on total cholesterol, LDL, HDL, or cardiac risk profile. And consequently, in previous videos, I've advocated initiating a statin of some sort to mitigate this cardiac risk profile. If you ignore the cardiac risk profile from dyslipidemias, despite your best efforts, you will certainly succumb to a stroke or a major cardiac event sometime in your 80s or 70s if you're unfortunate. So metformin and niacinamide are beneficial, but leaves many holes in mitigating the hallmarks of aging or improving the hallmarks of health. So let's talk a little bit about glycine and N-acetylcysteine. I looked at a variety of adjunctive treatments to augment the effects of niacinamide and metformin. And in that decision, these treatments should have no interactions with metformin and niacinamide. They should be readily available and cost acceptable. Both glycine and N-acetylcysteine are both over the counter. Minimal toxicity and side effects, and as well, the most important criteria is multiple well-conducted human studies on pharmacokinetics, pharmacodynamics, and outcome. A publication in Clinical Translational Medicine in 2021 presented a very interesting study, which was well conducted. It was with glycine and N-acetyl supplementation in older adults. That's older than the age of 65. It was a clinical trial of 8 older adults and 8 younger adults. Glycine and N-acetylcysteine were administered daily, and this was continued for 24 weeks. And the results demonstrated a recovery of glutathione, a main chemical in the cell that maintains redox status and is extremely important for minimizing oxidative stress, recovery of mitochondrial function, and a multitude of other functions. It provided something called glutathione rescue. And no significant adverse effects were identified. That's the most important outcome of this study. And multiple aging hallmarks were improved. So this is a cartoon of the study outcome with adults 71 to 80 years old. And what we see is an amazing improvement in the phenotype of inflammaging, which is recovered to young adult controls. Oxidative stress is decreased. Mitochondrial fuel oxidation is improved. The respiratory quotient is decreased, which is what you see in young adults. Markers for inflammation, IL-6, tumor necrosis factor alpha, C-reactive protein decreased. Insulin resistance is decreased. Endothelial function is improved. A marker of genomic toxicity is improved. And then finally, they were able to demonstrate improvement in physical function and cognition. So glutathione is the master determinant of redox status of a cell. It determines and reacts and minimizes any form of oxidative stress from metabolism. Cellular levels decline during the aging process, secondary to a reduction in synthesis and a decline in substrate availability, those substrates being N-acetylcysteine and glycine. N-acetylcysteine and glycine are rate limiting in glutathione synthesis. And supplementation with glycine and N-acetylcysteine restores glutathione concentrations to young adult levels. That is amazing. Its primary function in the literature as an antioxidant and reducing agent for reactive oxygen species. And I think, and we're not attempting to minimize reactive oxygen species. Again, all we're trying to do is to recover the glutathione concentrations to what they were in a younger adult. In the 1960s, there was a mitochondrial free radical theory of aging that was proposed. And what it stated is that we age because of an excess of reactive oxygen species. However, this theory has been truly refuted, and it has been revised. Reactive oxygen species that we see in the body, hydrogen peroxide, and a variety of others, this is a stress response. It's not the cause of aging. So, about 7.5 grams of glycine were administered daily, and approximately 10 grams of N-acetylcysteine were administered daily in a 75 kilogram person. That was the dosing that was used during the study, which is manageable and cost effective. Now the other question is why don't we just take oral glutathione as a supplement? Well, studies have demonstrated that oral glutathione is digested in the GI tract and also can't be absorbed by the cell. It's a negatively charged entity. There's no way for it to get into the cell for utilization. And it's extremely expensive, so don't waste your money. This is a cartoon of glutathione synthesis in the cell. It starts off with an amino acid called glutamate, which is then bound to cysteine, another amino acid. And then that dipeptide is bound to glycine, forming a tripeptide. So glutamine, cysteine, glycine, and that's glutathione. And you can see the two versions of glutathione. The reduced version is on the bottom with the disulfide bond. The oxidized version is on top with the sulfur hydride bond. And it goes back and forth. And in the human body, the majority is in the reduced form, and the oxidized form is then repleted. Now, there are multiple diseases associated with glutathione deficiency, and I make the note that this is an association. Whenever you see the word association in the literature or in the lay press, it can go both ways. And what that means is that, for example, Alzheimer's disease might cause glutathione deficiency by an unknown mechanism, or glutathione deficiency may contribute to Alzheimer's disease. We just don't know because the studies haven't been done. But nevertheless, glutathione deficiency has been demonstrated in Alzheimer's, Parkinson's, amyotrophic lateral sclerosis, Huntington's chorea, multiple pulmonary diseases, cardiovascular diseases, age-related diseases like cataracts, macular degeneration, glaucoma, autoimmune disease like systemic lupus erythematosus, and the aging process itself. So it cannot be ignored. It's a major player in the aging process. Now, N-acetylcysteine is the precursor of cysteine, which is an essential component of glutathione synthesis. And we have an extensive historical database on N-acetylcysteine. It's been used since the 1960s as a mucolytic agent. It disrupts thick phlegm and allows you to cough it up. 1970s, it was introduced as an antidote for acetaminophen poisoning by replenishing hepatic glutathione. I have extensive experience in its usage. When we use it for an acute toxic acetaminophen exposure, we give 10 grams in the first hour, another 10 grams in the next 24 hours when it's given intravenously. Side effects are minimal. It works amazingly well. And again, what we're doing is we're recovering glutathione to normal young adult levels, glutathione rescue. If you're young and your glutathione level is normal, this treatment will have no benefit for you. Minimal effects of supplemental N-acetylcysteine in the absence of glycine. It still works, but doesn't work as well. And that's why you add both together. Now, individuals with a sulfur allergy, unfortunately, should not take this medication because their allergy will be manifested. And the main side effect of using N-acetylcysteine orally is nausea. And you can get around that side effect by dosing it multiple times during the day. Glycine is a non-essential, inexpensive, and well-absorbed amino acid. It's in every meat stuff you can think of. However, for whatever reason, glycine availability as we age becomes limited and continues to decrease, and further research is needed to determine why that's the case. Dietary glycine is rate limiting for glutathione synthesis, so we need it. And this is problematic for vegetarians and vegans who need to be mindful that they need to get their essential amino acids and glycine. Clinical doses from 3 grams to 0.8 grams per kilogram have been done in multiple human studies, and no significant adverse effects are noted. One interesting evolving research topic is the effects of glycine on methionine restriction. Methionine restriction has been demonstrated in mice to extend lifespan and inhibit tumorigenesis and oncogenesis. And this needs more research, but it's very compelling and very interesting. And it's also a major component of collagen, elastin, the connective tissue matrix from which our entire body is made from. Now, there are multiple other studies on acetylcysteine, and I just wanted to focus on the relationship of antioxidants to cancer and tumor initiation. This is also a very heated topic. There was a nice article written in Science Translational Medicine about the concerns that N-acetylcysteine supplementation may lead to a higher incidence of cancer. And if you look at these studies closely, what you find is that in their mice models, they're using approximately 10 times the dose of N-acetylcysteine that you'd be using in a human being. So I think applicability to normal humans using the dosages I stated is very, very limited. However, it does recall that about 20 years ago, a huge study published about the use of vitamin A and vitamin C to prevent the incidence of cancer in a well-conducted, double-blind controlled study, which demonstrated a higher incidence of cancer. So we have to be mindful of that. And you know, if new studies in the future demonstrate harm, well, we should abandon this. Now, in acetamin overdose, where I have my most experience with, we use 20 grams of N-acetylcysteine administered over the course of 24 hours, and in that setting, minimal toxicity, minimal side effects, and incredible benefit in terms of recovering glutathione and minimizing the hepatic injury. We also use it frequently in medicine in alcoholic liver disease. There was a study done 6-7 years ago in idiopathic pulmonary fibrosis where 600 milligrams was given 3 times a day for an extended period of time in the absence of glycine, and no benefit was demonstrated in terms of preventing the progression of disease, but no other markers were looked at, unfortunately, to see if it had additional benefit not noted in the study. Now, just a commentary on the principles of nutraceuticals and pharmaceuticals for safety purposes. You start one drug at a time to assess for adverse events or toxicity. Start at the low end of dosing. If a treatment makes you ill, stop using it. You can try it again in a week or two and see if the same event happens, and then it's not really for you. These treatments take a long time to work, on the order of weeks and months to years. And so it requires a commitment to stay with the program. And then, most importantly, you need to stop these treatments when you're acutely ill. They will not help you recover faster and may actually aggravate your underlying illness. And ideally, a licensed physician should oversee these treatments for safety, frequent laboratory, and vital sign monitoring. Some final thoughts. So, can long-term treatment with metformin, niacinamide, glycine, and N-acetylcysteine attenuate any of the hallmarks of aging? Well, I can speak for the past 5 years. Metformin and niacinamide has been beneficial. It has changed my physiology in a positive way. And if I had to put a number to it, maybe retarded the aging process by 5 to 10% at the most. But that's not enough. We need additional treatments and adjuncts. So I'm hopeful that glycine and N-acetylcysteine will be useful, and I'll be giving another update in 6 months to a year to give you my thoughts on the matter. So just in review, what can be done in 2021? Well, dietary manipulation is being done everywhere. Fasting intermittently, ketone diets, these are all wonderful, and I think the data is still out on whether or not they'll truly extend health span or lifespan. Pharmacologic manipulation is what I'm doing, what this discussion is all about, and I think I remain optimistic, and I look forward to seeing what the results would be. Genetic manipulation is in every journal of medicine and science. Every day for the last couple years, you see an amazing story about a new protein, a new mechanism that contributes to the aging process. I just want you to realize that these therapies, if they ever do become therapies, will take years before they make it to the market, will be incredibly expensive, and will not be available to the majority of the population. So what I'm proposing today is a polypill therapy, 4 separate medications that all have independent and different effects on the aging process. This is a polypill therapy. Polypill therapies are frequently done in medicine. They're done, for example, when treating hypertension, treating cancer. And polypill therapies often have multiplicative benefits versus additive benefits because you're interrupting and improving components of a therapy that's components of a mechanism or disease that's very dysfunctional or deranged. So we can only see if the benefits will be helpful in the near future. So stay tuned, and thank you for your attention.